It's the time of year when respiratory illnesses are on the rise. Knowing your healthcare options ahead of the holiday season is important, and joining me in the studio is Dr. Karim Ali, Medical Director of Infection Prevention and Control at Niagara Health. Dr. Ali, what are some common respiratory illnesses?
So thank you for having me. And the most important things to be aware of during this season, the respiratory season that typically starts in November and lasts up until April. Being on the lookout for influenza and now COVID as well, and then other respiratory viruses like rhinovirus, which is called the common cold virus. And there is another huge list of assorted viruses. But things that we really focus on are influenza, COVID, and the likes. Yeah.
A lot of something I hear about is walking pneumonia. Can you tell me about that?
There has been a recent rise in cases of this walking pneumonia. Now, walking pneumonia is basically a term that's used for atypical pneumonias. When we commonly think of pneumonia, we think of a bacterial pneumonia that makes people very sick and puts them in the hospital. This is a relatively milder, right? And the focus here is relatively milder form of pneumonia, but it has the capacity to make children and young adults quite ill.
Okay.
It's caused by a bacteria that's sometimes difficult to grow, called the Mycoplasma pneumoniae, and that is one of the common causes of this. And we have seen a rise in these cases of pneumonia in children, young adults, and even adults this time around. It causes outbreaks every 3 to 6 years, so looks like we were due for one. But that is something on top of all the cough and cold symptoms that people have during this season. This is a significant illness that you should be aware of, and timely antibiotics and all.
Well, if people are experiencing symptoms, what are their best options in seeking care?
The first and foremost, I would say, is your family doctor. So making sure speaking with your family doctor, or here in Ontario, right, like now pharmacists can also prescribe some medications for minor illnesses. I mean, I want to make sure we understand that hospital is always going to be around, right? And just before, if you think you are significantly ill, then coming to the hospital is reasonable. But for minor complaints, first seeking those options is probably the best way to go. And the other thing that's available with Niagara Health is what's called the virtual urgent care. So this is convenience from your own home. You can access and speak to a nurse practitioner about the next steps and how to seek care and all. So that's yeah. Sorry.
There are lots of options out there.
Absolutely.
For seeking healthcare. What are some of the best preventative measures to get us through flu season without being sick?
So I think when we talk about cough and cold and respiratory season, every season from now on, we should think of those pillars of prevention. So the first and foremost, I would say, is making sure that you're up to date with your vaccines. If you're due for your vaccines, then making sure that your COVID and influenza vaccines are up to date, especially if you're in the high-risk category. This time around, RSV vaccines are also available for elderly and high-risk groups. So making sure if that is appropriate for you to be updated on those. Then the basics, right? Like the big pillar is the basics of infection control, which is covering your cough when you cough or sneeze, and sneezing into your elbow. Making sure if you use a Kleenex to throw it out and not put it in your pocket. And sanitizing your hands, washing it with soap and water or alcohol-based hand rub is one of the best ways to ensure. And you know what, like I understand it's not possible for everybody, but to the best of your ability, staying home if you're sick. That is something that we can all, these pillars we can focus on to stay safe and healthy.
Well, where can people go for more information to help get them through the season?
So Niagara Health's webpage, the website has the options listed, right? Like it's very prominent, and I would encourage people to just go visit the homepage of Niagara Health to get that information.
And so before people come to the hospital, there are lots of options out there.
Yep. But always remembering we are always here, right? Like hospitals don't close on holidays. We are there to help you when you need it. So.
Awesome. Dr. Ali, thank you for being our guest today. Thank you for all that you're doing at Niagara Health, and I hope you and yours have a very happy holiday.
Happy holidays. Thank you so much for having me.